You're on Outside the Beltway. I'm John Fredericks, and I am your blowtorch, your free speech in America. Great to have you with us. As always, TGIF live on the Strip in Las Vegas at the Paris Hotel. And Dr. Peter McCullough coming up, one of my favorite guests of all time because he's right like 1,000% of the time. It's like he would be in the Baseball Hall of Fame right now. He'd be inducted. Remember when he first came on the scene? And they called him a quack, and they said he was a conspiracy theorist, and they deplatformed him, and he couldn't go on YouTube, and he couldn't go on this, and he couldn't go on that, and nobody was covering stuff. They tried to take his license. And now we look back on it, and every single thing he said was 100% correct from day one. The guy is batting 1,000. He's got a better batting average than Ted Williams here. Joining me now is the one and only Dr. Peter McCullough. Doc, great to have you back, sir.
Thank you.
Doc, look, let's get right to it. I want to get to this vaccine. They're still pushing it. They're still pushing it with public funded dollars on these television ads to get vaccines for babies, funded by our tax dollars, right? You see them all the time. And you have made a pretty dramatic statement on giving vaccines to babies and on regulatory agencies' approval, but yet this is still happening. Can you square this for us, Dr. McCullough?
It was unprecedented to place an experimental genetic vaccine on the childhood vaccine schedule with no data on long-term outcomes, no assurances that this was going to be safe. The FDA had already put warnings that the vaccines cause heart damage in young people. So this was placing children in harm's way. Children don't get serious COVID-19. Even if they have symptomatic illness, they're easily treated, even those with cystic fibrosis and lung disease. So it wasn't medically necessary. It wasn't clinically indicated. And it wasn't prudent to do this. We simply didn't have the data. Now, a report out of the UK today, John, indicates that only 11% of children in the UK, where they had more severe mandates and promotion, only 11% of children under age 5 took the vaccine. The CDC doesn't report data that way to the United States, but I anticipate it's the same or lower. So most parents didn't go for it.
So when they don't have the clinical research backing it up, I'm dumbfounded as to why they're pushing it on infants and why they're spending public funds with TV ads encouraging parents to do this when there's actually no fact check behind it that it does anything other than harm. Like, what would be the objective here?
The vast majority of our FDA commissioners, when they're done in their job, their public service job, they join Big Pharma. They're part of this biopharmaceutical complex. And what we've seen in the last few years, it looks like the regulators now are captured by the pharmaceutical industry. They get lucrative jobs afterward. This is happening all over. Top public health officials, United States, UK, Denmark, they go to Big Pharma, particularly now vaccine manufacturers. We know now that Peter Marks at the FDA, Robert Califf, they're out there promoting vaccines for theoretical benefits that they're not even listed in the consent form. For instance, Califf has gone out there and said, well, take a vaccine to protect your senior citizens from death, mortality reduction, or that they stop transmission. That's not even in the consent form. Randomized trials have never shown this. Our FDA has never gone out and become an arm of pharmaceutical advertising. They're supposed to be regulating the pharmaceutical companies, not doing their advertising. So you can see something has gone very, very wrong. We need very strict inquiries on what the FDA is doing with this COVID-19 vaccine program, because they're really at the heart of the problem.
The injuries that people are receiving now, and we're getting reports every day from those that took multiple vaccines, what is your message to them?
Each vaccine, John, is like playing a game of Russian roulette. I saw a patient in the office yesterday, defense contractor, and he had taken 4 shots and tolerated them okay. But on the 5th shot is when he got serious myopericarditis. He got really sick. In fact, in the peer-reviewed literature, there can be fatal cases that occur on the 5th and 6th shot. Think about this. It's unprecedented that a vaccine would take these many injections. Someone who's strictly following the government program from the beginning, they're on their 12th shot. What vaccine would take 12 shots with no end in sight? The toxicity must be extraordinary at these high levels. We measure antibodies to the spike protein. They're off the charts at that level. My concern is that if this keeps going, more and more people are going to go down with serious injuries, disabilities, and sadly death.
When are the agencies, the regulatory agencies, going to be held accountable, Dr. McCullough?
The FDA reports to HHS, and that's Secretary Becerra. He's shown no signs of having any interest in vaccine safety. The FDA has shown no signs. There are 5 committees in Congress that have some loose oversight over the FDA. None of them are very strong. You know, I testified in the U.S. Congress on January 12th, 2024, making a call to pull them off the market and for Congress to actually make the public call to remove the vaccines from the market. And the feedback I got is that there simply wasn't the will right now. There's not the public will or the congressional will to make the call and pull them off the market. Rasmussen survey is out. 53% of Americans think the vaccines are causing serious side effects and leading to large numbers of deaths. But that means 47% don't believe that. So we're still at a very difficult tension point in this failed vaccine campaign.
You know, Dr. McCullough, when you say that that Congress doesn't have the will, you've got the evidence. So don't have the will to do what? Pause something that you've got now dramatic evidence, one after the other, that to some people causes great harm. I mean, why would they not have the will to simply get these off the market?
I think it's psychological, John. The majority of the members of Congress, they took the vaccine. And as you know, when people take the vaccine, you can't get it out of the body. And someone has to be fairly mentally strong to handle the psychological impact that potentially they've taken a product into their body that could cause harm. So we have this personal psychological bias that is playing a role. Most people you talk to who've taken the vaccine and you bring up a conversation on safety, you know what they say? They say, I don't want to talk about it.
And that's because they've taken it, so they don't want to deal with the fact that that's in their body, and you know, there might be a time where it rears its ugly head. If you took one shot and you took it when they first came out of 2021 or whatever, I kind of forget, 2 or 3 years ago, and you've had no side effects, and you only took the one shot, are you still at risk?
The one shot approach, which in 2021 would have been the Janssen vaccine or Johnson & Johnson. And I think it still depends on the early reaction in the arm. If there was not much of a reaction or no fever, systemic side effects, the data suggests probably the body tolerated it well, or the dose was, relatively small. The vaccines have never been inspected for kind of a dose quantity verification in the vial, so we simply don't know how much people are getting. I saw a patient the other day who took one shot in 2021. Now, she's developed a rheumatological complication. I measured antibodies to the spike protein in her, and she never had the virus. So the antibodies to the nucleocapsid were 0. But you know what? Even now, coming up on 3 years after the shot, John, she still has antibodies against the spike protein. So I can tell you, even though the vaccines don't work, they still raise a sustained immune response, which could lead to complications within the human body.
Incredible. Incredible that we went through this. Incredible that it got pushed on us, and it was over, 85% of Americans took at least one shot. It's just stunning. And still we can't get to the bottom of it. But look, I want to commend you for your company, and we can put this right up in the Chiron, Dr. McCullough's company that he developed, the wellness company. I want you to go to twc.health, twc.health/Godzilla. And what Dr. McCullough and his colleagues have come up with is something that I will not travel without. I've got 3 of these This is the Wellness Company Emergency Medical Kit that Dr. McCullough and his team developed. You carry this with you at all times. You have one at home. I've got one at home, one at the office, one on our MAGA bus. Why? Because in here at your fingertips is everything you need if something goes down. There's a guidebook with it. Now, you have to consult with a doctor online that they provide you with, one of Dr. McCullough's doctors. But you want to get one of these because if something happens, you get bit by a spider, whatever, you get COVID, it's got ivermectin, it's got Z-Pak. Dr. McCullough, tell us about some of the other things in this.
Well, we have the major issues of secondary pneumonias, bronchitis, urinary tract infections, yeast infections, common skin infections. So, if you're out in the woods and there's a scratch or a puncture wound and then an infection starts, we've got those appropriate antibiotics there. And, what people have been asking for is they've said, listen, I need some type of formulary at home. For every little thing, I can't go out to urgent care or the ER and pay a fortune just to get a prescription for antibiotics. And we learned through COVID that the pharmacies weren't pulling through, clinics were shutting down. So the Wellness Company medical kit gives people a lot of peace of mind, a lot of reassurance. And, people use them. I have patients tell me, listen, I was out on the road. This happened with disease X, which the WHO and the World Economic Forum says is coming. It's likely going to be another virus from a biolab. And while the virus we may be able to sustain, the concern is secondary pneumonias, and we have that covered in the medical kit from the Wellness Company.
TWIC.health/Godzilla.